There are several thousands of babies born each year, but what people often don't understand is that a large portion of these babies are born prematurely. Premature birth can cause medical and other problems not only for the baby, but also for the mother. Hi, my name is Mallory Dye, and as an individual going into the health field, I believe that it is important for people to know what premature birth is and what problems can be entailed in this condition. According to the Center for Disease Control, 9.6% of births every year are premature. And although this number has dropped dramatically in the past 7 years, it is still a large issue around the world. These statistics are strictly for the United States, but other countries have the same, if not higher, premature birth rates. The most common medical treatments are often expensive and technologically advanced, causing fewer countries to be able to take care of these special babies. Premature babies can develop several different problems after birth and can spend many months hospitalized. In order to be premature, babies must meet certain criteria. These babies may develop medical or other problems and might undergo extensive treatment. Premature birth is the largest contributor to infant death, raising the question for many people, what is premature birth? Premature birth, also known as preterm birth, refers to when a baby is born too early, causing growth and developmental milestones to be missed, especially in the later weeks of pregnancy. Commonly, babies born this early are due to risk factors, regardless of how the mom carried the baby during her pregnancy. The World Health Organization website has an article from 2015 that states most preterm births happen spontaneously, but some are due to induction of labor or because of cesarean birth, also known as a C-section, for medical or non-medical reasons. Babies who live through this trying time may spend weeks or sometimes months in a neonatal intensive care unit, also known as a NICU, and can sometimes encounter lifelong problems due to this condition. Premature birth is determined by the length of time in weeks a mother carried her baby. A full-term pregnancy ranges from 40 to 37 weeks. A baby born between the 32 and 37-week period is known as premature. And babies born less than 32 weeks are extremely preterm and often have many more issues than babies born after the 32-week period. If possible, obstetricians, also known as OBGYNs, encourage mothers to carry their babies full term or as close to term as possible. Like many other health conditions, though, premature birth can cause many problems, like intellectual disabilities, cerebral palsy, respiratory problems, visual problems, auditory problems, and digestive problems. These conditions have the ability to be lifelong or to be temporary, depending on the case and on the baby. Complications from premature birth can not only affect the baby, they also can affect the mother. Mothers can be affected by blood pressure increases or decreases, bleeding problems, and even the risk of infection. Family history of mothers with conditions such as high blood pressure or diabetes are encouraged to stay in contact with their doctor and make many visits during the pregnancy to ensure that the birthing process goes as smoothly as possible. Although this condition can cause several problems, there are also several treatments for these problems. Therapy, medications, and surgery are all different possibilities when making a treatment plan for a premature baby. Oftentimes, babies will undergo months of therapy to help auditory and speech delays, as well as intellectual disabilities. Surgery may be needed if lungs or the other organs are too underdeveloped. Although treating a small premature baby can be difficult, the treatment plans are advancing and offering better outcomes today than in recent years in the past. According to Susan Hall, a board-certified MD in both the pediatric and neonatal areas, 1 in 10 babies are born prematurely each year. The treatment of these babies not only shows how persistent and attentive the care must be, but also how the medical field is advancing. as the survival rates increase. I hope this leaves you knowing more about premature babies, as well as wondering more on the topic. Are there any questions? Thank you.